Can diverticulosis cause chronic diverticulitis? Imagine tiny pouches forming along your colon wall, often without you even noticing. That's what diverticulosis is, small pockets called diverticula that develop in the colon. It's quite common, especially as people age, and most folks with diverticulosis don't have any symptoms at all. But sometimes, these diverticula can become inflamed or infected, leading to diverticulitis. Now, the key question is whether diverticulosis can directly cause chronic diverticulitis. The answer is that diverticulosis itself does not cause chronic diverticulitis on its own. Instead, diverticulosis is a necessary condition because diverticulitis develops from inflammation or infection of those diverticula. Think of diverticulosis as the groundwork. If you don't have diverticula, you can't develop diverticulitis. But having diverticulosis doesn't mean you will develop diverticulitis, let alone the chronic form. When diverticulitis happens repeatedly or doesn't fully resolve, it can become what we call chronic diverticulitis. This means ongoing or recurrent inflammation that can cause persistent symptoms like abdominal pain, changes in bowel habits, or even blockages. Chronic diverticulitis often results from multiple episodes of acute inflammation or from a low-grade, smoldering inflammation that never quite goes away. Over time, this can lead to scarring and fibrosis around the diverticula, which might cause complications such as strictures or abscesses. It's important to understand that other conditions related to diverticulosis can cause ongoing symptoms without classic diverticulitis. For example, segmental colitis associated with diverticulosis or symptomatic and complicated diverticular disease involve chronic inflammation and discomfort but aren't necessarily the same as chronic diverticulitis. These conditions highlight how variable the inflammatory process can be in people with diverticulosis. In summary, having diverticulosis means you have diverticula, but it doesn't automatically lead to chronic diverticulitis. Additional factors like repeated inflammation or infection are needed to develop the chronic form. If you experience ongoing abdominal pain or other symptoms, it's essential to see a healthcare professional for proper diagnosis and management. Remember, each person's situation is unique, and medical advice tailored to your specific condition is always the best course of action.